Okay. So, good day everyone. So, we will be continuing our discussion yung iwan nating lesson. Okay? So, I believe tapos na lahat ng sections na handle ko sa hematocrit. I'm not sure lang sa RBC count, kaya I will start there. Okay? So, before I go to there, so I will just discuss this one. This is with regards to microhematocrit method of testing si hematocrit. Okay? So these are the common mechanical or biological sources of error, okay, that we can uh, experience when we test for hematocrit. First one is hemolysis. Okay, so hemolysis, you can see this kapag yung plasma is kind of pinkish. So you can see a decrease in your hematocrit. So false decrease siya. So what you should do is you should redraw the sample. Next one, proper sealing of capillary tube. Okay? So if yung clay niyo is not properly sealed or hindi siya nag-hold, mangyayari is matatanggal or mawawash out lang din yung inyong yung nasa tube, yung blood sa tube. So what you can see as a result is decreased hematocrit niyo. And in most cases is nauubos din talaga yung blood sa capillary tube. Okay? So what you should do is fill new capillary tube, okay, and making sure na properly sealed na siya. Okay? Underfilled original sample. If you're gonna get from there are two methods kasi that you can do using the hematocrit. Pwedeng directly from capillary puncture, pwede rin naman na galing sa evacuated tube, which is galing sa EDTA. Kapag underfilled yung EDTA ninyo, okay, so what you can see is decreased CNC hematocrit because of the excessive because of excessive anticoagulant. Okay? Okay, so what you should do instead, you can perform automated hematocrit or kaya redraw the sample, making sure na properly filled na yung evacuated tube niyo. Next is inadequate centrifugation. So you should centrifuge it at 5 minutes for greater than 10,000 RPM. Okay, so 10,000 sa 15,000 yung RPM na need natin. Okay, if less than that, okay, so what you can see is an increase, okay, because of the trapped plasma. Okay? Delay in reading after centrifugation. So after 5 minutes of centrifuge, tapos hindi mo agad siya ni-read. For example, iniwan mo lang siya nakahiga for an ample amount of time, you can see an increase, okay, due to unpacking of cells. Okay, so nag-start ulit siyang maghiwa-hiwalay. Okay, so i-recentry nyo lang siya, okay, before mo i-read, or kaya naman ay kung hindi agad ma-read is it's stored dapat upright at hindi nakahiga. Buffy coat included when determining, okay, so as stated, dapat hindi kasama yung buffy coat when you read. Okay? Abnormal red cell morphology, kapag may poikilocytosis, you can see an increased hematocrit because of trapped plasma. Okay, so what you should do in this case is you should perform an automated hematocrit. Okay? Yeah. So let's move on with RBC counting. Okay, so you have your handouts naman 9. I won't be discussing the in detail yung procedures. That's for the laboratory part. Okay. So we test, okay, for RBC, okay, to test for in alignment with testing for your hemoglobin. Okay. What are the symptoms of your high RBC level? Number 1, joint pain. You can see joint pain. This is because of the this effect, okay, because of uric acid. Okay? So uric acid is one of the byproducts of metabolism or waste product ng metabolism ng RBC. Okay, so if marami kang RBC, marami kang waste product, marami kang uric acid, so this uric acid nag-store or pumupunta sila sa in between the joints, which causes your joint pain. The tenderness in the palm of the hands or the soles of the feet, itching, Sleep disturbance, this is because of hyperventilation. Okay, so if you have a increase in RBC, technically you would also have increase in hemoglobin. So which causes hyperventilation because of high oxygen levels. What are the causes of high level of RBC? Okay. Cigarette smoking, okay, because of increase C. When you smoke kasi, nag-i-increase si carboxy hemoglobin. Okay. When you say carboxy hemoglobin, okay, so this hemoglobin, they carry CO, carbon monoxide, instead of CO2 or carbon dioxide. Si carbon monoxide, it has 200 times higher affinity, okay, than your oxygen. Meaning, mas gusto ni RBC or ng hemoglobin kumapit kay carbon monoxide kaysa kay oxygen. Okay? So if you have high carboxy hemoglobin because of the smoking, okay, so ang tendency is makukulangan ka pa rin sa oxygen kasi ang bit-bit ng hemoglobin mo is carbon monoxide. So if kulang ka sa hemoglobin, you will have hypoxia, which will stimulate the production of your RBC. So in the end, you will have high levels of RBC. Congenital heart disease, dehydration because of hemoconcentration, renal cell carcinoma, pulmonary fibrosis, and polycythemia vera. So these are the examples ng, or cases wherein you will have an increase in RBC. Symptoms with low-level RBC. So basically, parehas lang ng symptoms ng anemia. You have fatigue, shortness of breath, dizziness, increased heart rate, headaches, pale skin. What are the causes naman ng low-level RBC? If you have anemia, different causes ng anemia. Bone marrow failure, kapag hindi na nagpo-produce ng enough RBC, erythropoietin in cases ng kidney diseases. If you have hemolysis, internal or external bleeding, leukemia, or malnutrition. So these are causes ng low-level RBC. Malnutrition in the sense, for example, kulang ka sa iron sa pagkain mo. Okay, so you will have iron deficiency, anemia, ganun. Okay. So what are the methods that we used in checking for RBC count? Again, we have using automated analyzers. Okay. So usually the method here is electrical impedance, which already discussed na yung logic behind it. Okay? So ano-ano pa yung component included in your complete blood count? So we also test for our red blood cell or RBC count, white blood cell count, and differential, WBC differential, okay? Platelet count, hemoglobin, and hematocrit. Okay? So ito yung mga kasama sa RBC, CBC ninyo using your automated analyzers. Okay? So how do we count naman for manual RBC using hemocytometer? So this one, I believe, is already discussed in your laboratory kasi alam ko na kapag RBC counting na kayo. So I won't be discussing na yung inyong procedure. However, nonetheless, sorry, you have ano naman, ay handout naman. Okay, so I will just further discuss na lang itong part na to, which is ito yung quite confusing, okay? Sometimes. Okay? So again, let's discuss kung paano po mag-compute ng inyong na-count po sa using your Neubauer chamber. Okay? So yung Neubauer chamber ninyo, it is it looks like this, divided into 9 big squares or 9 primary squares, and then further divided into smaller squares. Ang isang square po na ganito, isang WBC square, this has an area of 1 millimeter squared. Okay, 1 millimeter squared. So since you have 9, okay, so ang total nito, itong buong to, is 9 millimeter squared. Okay? Yeah. So knowing that, for example, you have counted in 4 WBC squares, so yung total area mo would be 4 millimeter squared. So saan papasok to? Bakit kailangan natin itong alam? because of the formula. What is our formula in here? Universal formula po. Okay? That is number of cells counted times your dilution divided by area times volume or depth. Okay? So ito po yung universal na formula basta gagamit ka ng Neubauer counting chamber. Okay? So in some references kasi medyo naiiba siya. Medyo nag-iiba kasi namomodify na siya. Pero ito na yung pinaka-basic. Okay? So just remember this po, hindi ka na malilito. Okay? So, number of cells, syempre kung ilan yung nabilang mo, dilution, depende kung ano ginamit mong pipette. If you have used RBC pipette, okay, so that has a 200 dilution. Kung ginamit mo naman is WBC, that has a 20 dilution, and so on. So, depende sa method mo, dun mo gagamitin yung dilution. Okay? So, if you're counting eosinophil count, it also has different dilution, and so on. Okay? Yan. So, dun magagaling yung dilution. Area, manggagaling dito. Okay? Knowing na ang isang ganito is 1 millimeter squared, okay? So, you can adjust based sa case. Okay? So, you know, ang RBC mo, it is counted in the central square. Okay? Yung central square mo is further divided into 25. Okay? So, 1 millimeter square, that would be 1 divided by 25. So, yung sabihin, yung isang RBC square mo, okay, ang katumbas is 0.04 millimeter squared. Okay, so ang isang RBC square ay 0.04 millimeter square. So, depende sa case. For example, the case given is you have counted in 5 RBC square, so 0.04 times 5. Okay, so if you have counted in 7, so 0.04 times 7, and so on. Okay? Yun yung ilalagay mo dito sa area na ito. Okay, so yan. And then times depth. Depth or this one is constant, 0.1. Okay? 0.1 po ito na constant. So saan nanggaling yung depth? Yun yung distance between the actual chamber and your cover slip. Okay, so doon po nanggaling yun. Okay? So ano ang final what do you call this? Final unit po ng ating using this formula. So that would be cubic millimeter. Okay, so that would be cubic millimeter. So bakit naging cubic millimeter? So yung area mo is millimeter squared. Depth mo is millimeter. Okay, so times that squared plus yung walang exponent. Okay, so di ba sa rule ng multiplication, that would give you cubic millimeter. Okay, and then yung dalawang nasa taas mo naman is parehong walang unit. Kaya ang final unit is per cubic millimeter. Okay, so I hope that clears that up. Okay. Yeah, I'll be skipping that na. Okay. Ayan. So, if you're gonna ask bakit ito is different from the formula, yan nga. Kasi iba't ibang references, tinitweak na kasi nila yung formula. Okay? So, ito. Ang given here is, it's a constant na. Okay? So, times 10,000. Saan nanggaling yung 10,000? That's because considering the dilution factor and the number of area ng RBC square mo and then the volume, doon nakuha yung 10,000. However, this won't work kapag hindi 5 RBC squares yung kinount. Like I've said, depende sa case. There are certain times na yung cases or case study given is hindi naman RBC square or hindi naman consistently 5 RBC squares yung binibigay or sa WBC hindi consistently na 4. Okay, so iba-iba. Iba-iba. Okay, so you have to remember the basic para kahit i-tweak yung case or yun nga, yung case is you still know how to answer it. Okay? Ayan. So, moving on with RBC indices. Okay. So, what are RBC indices? So, RBC indices are calculated parameters that are part of an automated blood count report. So, apart from dun sa pinakita natin kanina, yung part ng kasama ng CBC, which is the RBC count, hematocrit, hemoglobin, WBC count, platelet count, WBC differential. Apart from that, we also have what we call RBC indices. Okay, so what are the uses of this? So two primary use of RBC indices. Number one is to assist with the differentiation of anemias, and number two, serve as quality check. So further, later on, mas maintindihan natin kung bakit it serves as yung uses ba nito. Okay? Mas mag-visualize natin dito. So we have three RBC indices. We have the mean cell volume, mean cell hemoglobin, and the mean cell hemoglobin concentration. First, let's talk about the mean cell volume. So this one refers to the average size of the RBCs constituting the sample. Okay? So take note of the average size. Okay, so we're talking about the size of your individual RBCs. So reporting unit natin is femtoliter. So this one, please, hindi naman memorize, but be familiar. Okay? So, sa RBC indices kasi hindi nagkakalayo yung mga reference ranges natin. Okay? So, this one, yung 80 to 100, parang ito na talaga rin. Okay? Yan. So, this is our formula for MCV. Okay? So, MCV equals hematocrit in percentage times 10 divided by your RBC count in this unit times 10 raised to 12 per liter. Okay? Yan. So, if given si hematocrit as liter per liter, okay, paano yung pag liter per liter kasi it is presented as, kunyari, katumbas nito, it is 0.42. Okay? So, just move this, remove this, percentage na siya. Okay? So, first, remember here, remember nito ha, kasi ayun, in some cases, hindi yan yung given, you should transpose it pa. Okay? So, hematocrit in percentage times 10 divided by your RBC gives you your MCV. Okay? Yeah. So, what are the indications of the variations in the levels of your mean cell volume? Okay? Kapag po pala, let's go back. Kapag po pala 80 to 100, well, if it's less, this one is normal. If it's less than 80, it means maliliit yung RBC mo. If it's greater than 100, it means malalaki. Okay, so this in this side, it's microcytosis. In this side, it is macrocytosis. Okay, so what are the indications of high MCV? High and low MCV and normal MCV. Okay, so lahat po ng cases na to, okay, sa lahat ng cases na to, you can see po, you can observe that they have low hemoglobin, sorry. Okay, so in this following cases, okay, so high MCV, okay, let's try to compute so we can visualize. Okay, so high MCV, knowing the formula, let's write hematocrit times 10 divided by RBC. Okay. So if your hematocrit is high, let's have an example. Okay. Hematocrit is high, gives you, for example, you have 50 divided by 4.2. Okay. So for example, your hematocrit is high, your RBC is normal. It will give you a high MCV. Okay, so high hematocrit, RBC is normal. Normal. Okay. So kapag dito naman, okay, you have low hematocrit. Okay, for example, hindi ko na bibigay yung numerical value ha. I'm just figuring it out. Okay, so kabaliktaran pag low MCV, you can see low hematocrit and normal RBC count. Okay? So, ang nagbabago is yung hematocrit ninyo. Sa normal MCV naman, so parehas, normal hematocrit, normal, sorry. Okay. Pag normal MCV, I'm sorry. Pag normal MCV, you can see it's either they are both high or they are both low. Okay? So, parehas sila. Okay? So, either they are both high or they are both low. Okay? So, this one is the same ng trend. Okay? Yeah. So, let's associate it with in these cases. Okay? So, in here, sudden significant blood loss. So, we can see or we can expect here na mababa si hematocrit. Okay? So, mababa si hematocrit, of course, mababa din si RBC count. Okay? So, bakit normal yung average size? Okay? So, this one, itong mga to, normal yung average size kasi wala kang problem sa production. Okay? Nagkaroon ka ng sudden blood loss, that is the reason kung bakit bumaba si hematocrit, bumaba si RBC. Unlike in here, okay, in here, low MCV, it means maliliit yung ating RBC. Maliliit sila. Okay? So that is because you have problem in production. Example, iron deficiency. When you have iron deficiency, okay, you would have iron deficiency anemia. If you remember, iron is an integral part of your hemoglobin. Kung wala kang iron, okay, wala ka ring, or hindi magiging normal yung inyong RBC. Kung kulang ka sa iron, which is the center of your heme, if you remember, you have your iron here, then you have your protoporphyrin, okay, tas 4 yung heme sa isang hemoglobin, di ba? Kung kulang ka ng iron, makukulangan ka ng heme, therefore, yung space na supposedly for hemoglobin is hindi ma-occupy. Kaya maliliit yung inyong RBC. Okay? So, normal yung decreased si hematocrit kasi maliliit sila. Okay? Normal yung RBC count mo kasi one way for your body to compensate, di ba, kapag may hypoxia is to stimulate the production. So, you have a lot of RBC, or you have normal RBC count kasi nako-compensate. However, maliliit naman sila. Kaya yung overall percentage of your RBC nagdi-decrease din. So that's why yung hematocrit mo is decrease. Okay? Yan. Okay? So that's example for iron deficiency. Okay, we will talk about this once we go on sa what they call this? Sa diseases. We will further discuss pa din. Okay? So high MCV naman, si high MBC is decrease yung increase yung size. So, malalaki yung RBC. Okay? Decrease si hematocrit kasi nga malalaki sila. So, yung malalaki, kapag pinak mo sila, okay, so mas marami yung kakainin nilang space. Okay? And then, normal yung RBC count mo still. Okay? Normal RBC count kasi, normal. Okay? So, vitamin B12 deficiency and folate deficiency. So, this one is also examples of a type of anemia. Okay? So, vitamin 12 deficiency, folate deficiency, iron deficiency, these are type of anemias which we will further discuss kung bakit sila naging anemia pagdating natin sa anemia. Okay? Yeah. So, this is just a brief overview, okay, when you are talking about MCV. Okay? Yan. So, sana nakukuha yung picture. Okay? kapag, sige, later on I will include the photo po ng analyzer na pinapakita yung results. Okay, showing the MCV, the MCVs, and the hematocrit hemoglobin para makita natin yung association. Okay? Next one, we have mean cell hemoglobin or mean corpuscular hemoglobin. So the mean cell hemoglobin refers to the average weight of hemoglobin. The weight of hemoglobin in the RBC sample. The reporting unit is picogram. At this normal is 26 to 32 picogram. So this is the formula for your RBC. Sorry, MCH. Okay? So kanina is your hematocrit, yung ating value na kailangan sa RBC. This time it's hemoglobin and RBC. A hemoglobin, remember it is grams per DL times 10. And then RBC is same pa rin yung unit. Okay? So, yeah. For example, 12.5 times 10, okay, divided by 4.1 gives you 30.5. Okay? So, remember po yung inyong, what do you call this, unit. Okay? So, in cases na hindi ganyan, for example, it's given as gram per liter, so you should transpose it back. Okay? MCHC. Okay? MCHC refers to the amount of hemoglobin relative to the size of your cell. Okay? So amount of hemoglobin in comparison with the size. You see, MCH is just based on the amount or the concentration of hemoglobin. Okay? So si MCHC, comparing it or relative to the size of the cell. Okay? Or hemoglobin concentration for red blood cell. Okay, reporting unit natin is per grams per deciliter. Okay, and wait. Walang formula. Okay, so here is the formula of our MCHC. Okay, so MCHC equals this time ang needed values natin is hemoglobin still in grams per deciliter times 100 divided by hematocrit in percentage. Okay, so this is the formula, or okay, we have another one. You can also use MCHC equals MCH divided by MCV times 100. Okay, so you can use either this or you can use either this. Okay, again. So this is your formula for MCHC. Again, this is hemoglobin concentration per red blood cell. So, what are the indications of high and low MCHC? Kapag high MCHC, you can expect that this is hyperchromic. Example, hereditary spherocytosis. If you remember, yung itsura ni spherocyte, they are macrocytic hyperchromic RBCs. Okay, so you can expect high CMCHC. Okay, sickle cell diseases, homozygous hemoglobin C disease, these are high CMCH. Okay. Low MCHC, we can see na si iron deficiency anemia. So we can expect kung sabing low si MCHC, hypochromic naman siya, kabaliktaran. Okay? Ayun. So, hypochromic states of your RBC. Okay? So, again, example natin, iron deficiency. Kapag kulang ka sa iron, in the end, kukulangan ka din sa hemoglobin, which will be the cause of your, kaya siya hypochromic. Okay? Yeah. So, wait, I'll include Sa next slide, yung photo ng from the analyzer. Okay, ayan. So, this, I found, naghanap ako ng photo from our laboratory. Okay. So, this is an example ng result po na makukuha ninyo from a automated analyzer. So, this is a 5-part analyzer. When you say 5-part pala, meaning it gets yung 5 types of your RBC. Neutrophil, lymphocyte, monocyte, eosinophil, basophil, kaya niya i-differentiate. Okay? Kapag kasi, when you say 3 parts lang, hindi niya kayang i-differentiate si neutrophil from eosinophil, basophil. So, bali, ang ibibigay lang niya sa yung result is segmenters, lymphocyte, and monocyte. Okay? So, this is 5 parts, so kaya niya i-differentiate yung 5. Okay? So, we have yung differential count here, WBC count here, RBC count, hemoglobin, hematocrit, and then yung MCB, MCH, MCHC. Yan. Okay, so let's look at this. Let's talk about first MCV. If you remember, MCV is hematocrit divided by RBC. Okay? So, low MCV natin. Okay? So, low, if you remember yung sabi ko kanina, if your hematocrit is low, normal C, RBC, it will give you low hematocrit. Okay? So, low hematocrit, normal yung RBC count mo, low MCV. So, we can see here na microcytic ang inyong RBC. Okay? So, we can also associate it sa hemoglobin. Mababa si hemoglobin, it's also low. Okay? So, pero normal si RBC count. So, we can say na yung body ni patient is nagko-compensate po sa low hemoglobin. Okay? Kasi it still produces RBC, kaya yung kanyang RBC count is normal. Okay? MCH. Low din si MCH natin. Okay? MCH mo is hemoglobin, okay, divided by RBC. Okay? So, this times 10, times 10. Yan. So, hemoglobin times 10 divided by RBC. Okay? Times 10 nga ba or times 100? Kind of check na lang dun sa previous slide. Okay. Yeah. So, same logic here. If this is low, this is normal, we can expect na si MCH is also low. Okay, that means the average hemoglobin, okay, or hemoglobin per cell is low. MCHC mo also low. Okay, MCHC is also low because your hemoglobin is low. Okay, MCHC is the concentration of hemoglobin relative to the size. So low hemoglobin, low in size, or smaller RBC, microcytic. So we can see na low din si MCHC. Okay, another example, this one. Okay, low lahat ng RBC, hemoglobin, and hematocrit, pero normal yung tatlo. Okay, normal sila. Okay, kasi okay, if you remember kanina sa slide, kapag normal MCH, parehas yung trend ng hematocrit mo tsaka RBC. Your hematocrit is both low, so your MCV is normal. Okay? So, normal yung MCV. Ibig sabihin yung size niya, even though it is low, it's relative naman to the number of RBC. Okay? So, the average size is normal. Okay? So, ano ulit ang cases nito? It could be because of chronic diseases, sudden loss of blood, and so on. Okay? MCH. Okay? So, your MCH is hemoglobin relative to the number of RBC. Okay? So, low hemoglobin, pero you can expect na low hemoglobin kasi low din naman si RBC count. That's why your MCH is normal, which is the average hemoglobin. Okay? MCHC is average hemoglobin per cell. Okay? So, again, ang formula nito is hemoglobin divided by hematocrit. Okay? So, since low nga sila parehas, okay? So, normal si MCHC. Nagigets na po ba yung correlation? Okay? Yan. So, in this case kasi, low si hemoglobin kasi low, kulang ka ng RBC. Kulang sila lahat. Okay? Pero kaya yung indices mo is normal because yung trends, which is yung RBC parameters mo na tatlo, is pare-parehong trend. They are all low. Okay, that's why your indices are normal. The averages is normal. Okay? This one naman, baliktad. Okay? Normal yung RBC indices mo, however, low yung, normal yung RBC parameters mo, however, yung indices is low. Okay? Yeah. So in this one, let's look at the MCV first. MCV mo is low. Okay? Okay. MCV again is hematocrit divided by your RBC. Your hematocrit is normal, 0.13, 0.40. Yan. Okay? So this one is normal. However, it is in the lower, wait. Let's try to compute. Okay. Ayan. So, ayan. Okay. Ulit. Okay. So this one, MCV is low. Okay. Both normal si hematocrit. MCV again is hematocrit divided by your MCV. Both normal. However, si RBC ninyo kasi is on the higher and higher limit na. Okay, so this is near the limit na. Okay, however, si hematocrit is on near borderline na low. Okay? So mas malapit to sa lower limit, ito naman sa higher limit. That's why your MCV is low. Okay? MCHC also relative to the RBC count. Okay? That's why ganun din. Okay? Kasi yung inyong hemoglobin is more on or closer to the lower limit. So RBC is closer to the higher limit. That's why low si MCH. Normal si MCHC kasi ito naman hindi naman natin titignan si RBC count here, di ba? Ang titignan natin here is si hemoglobin tsaka si hematocrit. Hemoglobin divided by hematocrit. Okay? That's why normal si MCHC. Okay? So, anong image naman yung pwede nating form in this case? So, in this case, we can say, I'm not sure lang kasi kung babae or lalaki yung patient, hindi na siya na-picturean from my gallery. So, I have no idea. Okay? So, pero kasi if this is male, okay, we can say that close to anemic na si male. Okay? So, that's why maybe yung body niya nagre-respond kaya si RBC is on the relatively high side or closer to the higher limit. Okay? Yun. And then, if it is female din naman, okay, so if female siya, maybe this female is a smoker, that's why yung RBC niya is quite high, RBC count, or we cannot say kasi hindi natin alam yung history ni patient. Okay? It's also one of the reasons kung bakit hindi tayo pwedeng mag-interpret kahit alam po natin basahin yung resulta. Okay? We don't know the history of the patient, and sometimes we don't know all of the details. Yun. So, ang important is, you have to know kung paano you have to know kung to verify your result and to correlate it. So, in this case, do I know that this is correct or will I release this? Will I release it? So, the answer would be yes. Okay? So, in all cases, yes. Kasi tumutugma naman siya yung results from the indices. Okay? So, I hope I explained it na mas madali para sa inyo. If not, or quite confused, please message me if you have concerns. Okay? So, moving on, let's move on sa erythrocyte sedimentation rate naman. Okay? So, what is your ESR? Okay? So, your ESR indirectly measures the degree of inflammation present in the body. So, take note of the inflammation. So, it actually measures the rate of fall of erythrocytes in a sample of blood that has been placed into a tall, thin, vertical tube. Okay? So, results are reported as millimeters of clear fluid that are present at the top portion of the tube after 1 hour. So, basically, it is the rate of fall ng RBCs per hour. hour, per hour. Okay? Yan. Yan. So, this is an example. Okay? So, lalagay natin sa tube or sa tube yung RBC, yung whole blood, and then we will let it stand for 1 hour. Okay? And then, hahayaan lang natin siyang mag-fall, mag-settle on its own. Okay? So, kung gaano, yan, kabilis, for example, after 1 hour, ito na siya nag-stop. Dito na nag-stop. So, it gives you roughly less than 1. So, I think this is 1. Okay? Yan. Para less than 1, okay, that is your ESR. Okay? Yun. Yeah. Normal range for this one, it's 0 to 10 millimeter per hour. Sa male, female is 0 to 20 millimeter per hour. Okay, what are the stages of your ESR? So, pa-kindly add po ito sa notes ninyo. Okay, so since ang ESR mo nga, di ba, ay sa loob ng 1 hour, so that's 60 minutes, ito po yung nangyayari sa blood. In the initial 10 minutes, you will form rulu. What's rulu? If you remember, that is the coining or stacking pattern of your RBC. So, yun yung nangyayari in the first 10 minutes. 40 minutes, nagsasettle na yung RBC at a constant rate, dahan-dahan na silang bumababa. And then the final 10 minutes po, yung cells, they pack at the bottom of the tube. Okay? So what are the different factors? This is also additional. Kindly add it into your notes. What are the different factors affecting your ESR? Number 1, plasma factors. Okay? First one, rouleau formation. Kapag may rouleau formation, magkakaroon ka ng increased ESR, or meaning mas mabilis magpapack yung red cell mo. Why? Kasi na-skip na yung first phase mo. Okay? So first phase again is rouleau formation. If na-skip na yung first phase, so mas mabilis na silang magpapack at the bottom of the tube. Increased ESR. Increased fibrinogen and plasma proteins, you can also see increased ESR. Okay, that's because protein decreases the negative charge of your RBC that keep them apart. Okay, so your RBCs has negative charge. Okay, so magkakagalit sila. Okay, so if you have increased in protein, yung negative charge mo ma-alter, okay, mas magdidikit-dikit sa RBC, mas madali silang mag-form ng rouleau formation, thus increase ESR. Cholesterol mo, you can see increased ESR. Albumin and lecithin, decreased ESR. Red cell factors. Okay? If you have anemia, okay, you can see increase in ESR. Okay? So that's because if there are change in erythrocyte plasma ratio, it favors rouleau formation. Okay? For example, you have low RBC count. Okay, so konti talaga yung RBC mo, mas madali talaga silang magpapack, okay, at the bottom of the tube. Okay? Microcytes. Microcytes, you can see decreased ESR. That is because of decreased volume and increased surface area. Okay? Microcytes fail to settle. Kabaliktad na naman sa macrocytes, increased ESR. So that is because of increased volume and decreased surface area. Okay? So, di ba ito malalaki? So, yung malalaking cells, mas mabilis silang nagpapack kaysa sa maliliit na cells. So, mas mabilis mag-form ng rouleau or mag-pack, mag-settle yung macrocytes kaysa sa microcytes. Sickle cell, spherocytes, and other irregularly shaped RBC decrease ESR. Okay, so, pag iba-iba po yung shape ng RBC, mahihirapan silang mag-form ng rouleau formation. Pag nahirapan sila mag-form ng rouleau, which is the first phase of our settling, okay, so mas matagal mag-settle, does decrease ESR. Okay. What are the cases of increased ESR? Okay, so ESR again is a measure of inflammation. Okay, it somehow tells you that there is inflammation or there is a certain level of inflammation within your body. Okay? So you can see increased ESR kapag meron kang chronic inflammation such as rheumatoid arthritis, pregnancy, infections, malignancy, damage, severe anemia. Decreased ESR naman kapag may polycythemia, okay? Sickle cell anemia, spherocytosis, or other conditions with poikilocytosis. So these are cases, again, na affected si RBC. As we have talked about sa RBC factors, okay, yung size, yung shape, they affect the settling process, thus decrease CESR. Sources of false decreased TSR, clotted sample. Pag clotted ng sample mo, hindi na yan magsasettle at the bottom of your tube kasi dikit-dikit na sila in the first place. Okay? And then, ayun, hindi na rin sila, ayun nga, kasi clotted, ang tendency is mag-stay na lang sila in one place. Excess anticoagulant. Okay? So, also kapag old blood, pag matagal na, for example, it has been left standing or old blood sample na, okay, it causes decreased ESR. What are the different methods po of testing ESR? First, we have Winthrop and Landsberg. Okay? So, yung Winthrop mo uses double oxalate as an anticoagulant. ETA or double oxalate as an anticoagulant. So, this is how your Winthrop tube looks like. Okay? So, yung picture kanina, na tube, that's also Winthrop. Remember, Winthrop can also be used for hematocrit. Okay? So, Winthrop, meron niyang dalawang measurements. Isang 0 to 10, isang 10 to 0. 0 or, yes, 10 to 0. This one po is used for ESR. This one naman is used for hematocrit. Okay, so remember po dyan. Pag 0 to 10, it is used for ESR. Kapag Winthrop, kapag naman 10 to 0 na measurements, it's used for hematocrit. Dalawa kasi pwede paggamitan ng Winthrop tube. Dalawa din yung measurements niya. Okay. Western Gren uses black top with sodium citrate. Okay, remember po yung inyong anticoagulant. Okay, so this is how it looks like. And modified Western Gren. Okay. This one requires dilution of ETA blood, either using sodium citrate or NSS. And then, yan, using this, tube. Okay? So, itong modified Western Gren, this is yung most commonly used na ngayon kasi it's much easier to use than your Winthrop tube and also disposable na siya. Okay? So, isasalpak mo lang siya here sa tube mo and then aakit yung blood and then you will leave it standing for an ample 1 hour for 1 hour. Okay, additionally, kindly add din po ito sa inyong lecture notes. Okay. So, the sources of error for anticoagulant, as for ESR, sorry. Again, increased anticoagulant will have decreased ESR. Okay, increased anticoagulant causes spearing of RBC, which inhibits your Rulu formation. Uses of sodium or potassium oxalate and heparin, okay, it causes also increased ESR because it causes cell shrinkage. High temperature, increased ESR. Low temperature, decreased ESR. Tilted ESR tube. So if you remember sa inyong procedure, you should let it stand for 1 hour na upright position. Kapag konting tilt lang, as low as 3 degrees, it can accelerate your ESR by 30%. Delay in testing, okay, decrease in ESR. Okay, so after 4 hours okay, of standing, yung RBC mo, they will naturally form ruluna. Okay, so they will become spherical. Okay, kapag old blood sample, nagiging spherical na yung shape ng RBC, thus causing decreased CSR. Kapag may bubbles within your tube, okay, within your choice of tube na gagamitan either Winthrop or the modified Western Gren, kapag may bubbles, causes decreased CSR. Kapag may clotted, decrease TSR. Vibration, increase. Kapag too narrow is our tube, decrease din si ESR. Next up, white blood cell routine tests. Okay, so white cell count is the total number of leukocytes in a volume of blood expressed as thousands per microliter. So these are the total WBC count na tinatawag natin. So it can be done through manual or automated cell counters. So we have already discussed yung method, yung principle behind the automated ones. Okay? So for the WBC counting using your hemacytometer, it is still the same with your RBC pa rin. Okay, and also, I believe already discussed in your laboratory. Okay, so let's skip that part. Okay, for the calculation, just remember yung what I have discussed kanina na formula, and you're good to go na. Done. Okay, yeah. Let's proceed with differential counting. Okay, so differential counting, the pencils are examined in a vertical direction from bottom to top or vice versa. The procedure is repeated until 100 WBCs have been counted. So using this is called a differential counter. So while looking at the microscope, itatarak mo kung ano yung makita mong RBC, hanggang maka 100 ka. Kapag nakatotal ka ng 100, tutunog siya for you to know. Okay? And then kung ano yung nakuha nyo, for example, nakapagtarak ka ng segmenters or neutrophils ng, here is 65 plus 30 plus 5 na monocytes. So yun yung inyong report as 60% na segmenters or 30% ng lymphocyte and so on. Okay? So how would you read? Okay? So you will read in this area of the smear. Okay? Remember, yung area na to, it should be where your RBCs are close together but not touching. Okay? They are close together but not touching. So this one is, but not overlapping. Close together but not overlapping. This one, sa tail, talagang as a super thin part, you can see deformed na yung cells. They're also all macrocytes na or hyperchromic. Okay? So, hindi tayo dito nagbabasa. Okay? So, sa thick part naman, as you can see, hindi na masyadong kita yung central pallor ng cells. Okay? And then, patong-patong na sila masyado. Okay? So, ito yung optimal space where you should read. They are close together. May mga nag-overlap pero mangilan-ilan lang. Okay? And then, ayan. So, dapat basta hindi sila nag-overlap, hindi sila masyadong layo-layo. Okay? So, ito yung itsura niya. Okay? Types of WBC included in differential counting. You already know this. We have neutrophils. Neutrophils are serves as a primary defense against infection, particularly sa bacterial infections. Okay? Yeah. So for the neutrophils, we have different what do you call this? Normal values po. Again, depende sa references kasi ang normal values. Okay? Etong nasa column na to, these are absolute count. Okay? When you say absolute count, it pertains to the number of neutrophils per cubic millimeter. Okay? Same unit as to your RBC count, if you remember kanina. Okay? Pero mas relative or mas significant yung na you have to know yung number or yung percentage nila. Okay? So for this discussion, we will gonna be used na 50 to 60% yung inyong neutrophil. Okay? So again, depende nga yan sa references ninyo. Pero basically, if it is greater than 80%, doon nyo talagang masasabi na meron kang neutrophilia. Okay? Yan. Band cells. So you know now what is the band cell? These are baby neutrophils or baby na leukocytes. Okay? O yung pinanggalingan bago mag-eosinophil, bago mag-neutrophil. So these are your band cells. Okay? So increased in band cell, if you have increased in band cell, you can see, or you can say that you have a shift to the left, meaning, okay, they are released from the bone marrow because of increased WBC response, or in need yung katawan mo ng um, more responders for the infection. Lymphocytes, okay, so you have noticed they play a role in immediate and delayed response to infection, particularly din sa viral infection, sila din yung most active. The increased number of lymphocytes you can see in viral infections. Some bacterial infections decrease naman if you have cancer, immunodeficiency, storage, steroid exposure. Monocytes, so these cells respond to inflammation, infection, and foreign bodies. Again, as I like to call it, our cleanup guy ng inyong katawan. Okay? Increased sila if you are currently recovering from acute infection, viral illnesses, parasitic infection. Decrease naman kapag HIV infection, rheumatoid arthritis, cancers. Eosinophil, allergic and parasitic infections. Decrease naman in cases of stress and steroid exposure. Basophils naman, also for allergic reaction. Yeah, for allergic reactions. Yeah. So if you have any questions po, feel free to message me. Okay, so that concludes the end of our discussion for routine hematologic tests. Okay, so thank you for listening. Okay, and we're still not done. I still have another lesson po to share. Okay, and you just go on over there. Okay, thank you, and God bless.